This video shows how to use a puffer and spacer, the single breath method. Using a spacer is the best way to use a puffer because it helps the medicine reach your lungs where it is needed, instead of getting stuck on the back of your throat or tongue. Take out your spacer and puffer. Remove the cap and check the dose counter. Shake the puffer well. Insert the puffer into the spacer end. Check that the spacer is clean around the mouthpiece. Put the mouthpiece of the spacer between your teeth and close lips to form good seal, and breathe out gently into the spacer. Keep the spacer horizontal and press down firmly on the puffer canister 1 time. Breathe in slowly and deeply. Hold your breath for about 5 seconds or as long as comfortable. Then breathe out gently. If more than 1 puff is needed, take another by once again shaking the puffer, putting it in the spacer, pressing down once and taking a slow, deep breath. It's important to inhale 1 puff at a time. Then replace the inhaler cap to keep your puffer clean.